Hello. So the patient is Mr. AP. He's a 38-year-old Indian American male. He came in stating that I'm here for a checkup related to increase in urination and thirst. History of present illness is Mr. AP is a 38-year-old Indian American male with a history of generalized anxiety disorder, hypertension, and type 2 diabetes mellitus, who presents to the clinic today for a checkup. He has not been regularly monitoring his blood pressure or glucose levels at home. He is under financial stress, which he contributes to his health issues. He has gained 15 pounds in the last 3 months. He reports fatigue and generalized discomfort for the last 3 months. He states he is more worried than usual. He also complains of increased thirst and urination for the past month. He is taking his medication as prescribed. He reports a sedentary lifestyle that includes no exercise, eating takeout food frequently, which he eats to alleviate stress. The patient reports no allergies to medication, latex, food, or environment. The patient's home medication includes hydrochlorothiazide that he takes 50 milligrams PO daily for hypertension, metformin 500 milligrams PO BID for type 2 diabetes, and Lexapro 20 milligrams PO daily for anxiety. The patient denies use of vitamins or herbal supplements. The patient's past medical history includes generalized anxiety disorder that was diagnosed 13 years ago, hypertension, which was diagnosed 1 year ago, and also type 2 diabetes mellitus, which was diagnosed 5 years ago. The patient denies any past surgical history and also denies any hospitalizations other than a clinic visit to follow up on his diabetes and high blood pressure. The patient's present family history includes maternal disorder of hyperlipidemia and type 2 diabetes, and paternal, he has hypertension. Social history includes that he's a graduate student that eats takeout frequently but denies binge eating. He also denies exercise and admits to sedentary lifestyle. He also denies alcohol use or nicotine use. An exam showed that he has a height of 5'9". He weighs 233 pounds currently. He had a temp of 37 degrees Celsius, a blood pressure of 146/94 at his current visit, heart rate of 75, O2 saturation was 98%. His blood glucose on his last visit, which was 6 months ago, included a fasting blood sugar of 142 and an A1C of 7.5. 1 week ago, he had a fasting blood sugar of 210 and an A1C of 9.3%. His home monitoring from 4 weeks ago showed a random 218 blood sugar and a random 142/96 blood pressure. And 2 weeks ago, his home monitoring showed a 220 random blood sugar and a blood pressure of 144/92. Health promotion plans include Mr. AP. Health is at a significant risk for decline due to diabetes history, hypertension, and his sedentary lifestyle and diet. The plan is to order tests and labs to ensure no heart or organ damage due to hypertension or uncontrolled diabetes. The patient will be referred to a dietitian for intensive education on dietary interventions. Also, he will be referred to a diabetic educator for control of his diabetes. He will be started on a new medication regimen of glipizide and metformin for his type 2 diabetes and lisinopril and hydrochlorothiazide for his hypertension. We will give education about new medication regimen and precautions. We will discuss ways to reduce stress and refer him to a therapist to help with his anxiety and stress. We will also schedule a follow-up visit. Review of his systems include general positive for weight gain of 15 pounds in 3 months, fatigue and generalized discomfort. Cardiovascular, denies palpitation, shortness of breath, chest pain, history of blood clots, claudication. Genitourinary, complaints of increased urination but denies difficulty urinating, pain during urination, changes in urine characteristics. Neuro, no history of seizure, no sensory loss, no motor weakness, no migraines. Patient, affect is within normal limits. Patient's look is within normal limits. Patient is pleasant. Thank you.